In this video, I'm going to talk about palpation of the hip for physiotherapists to know what they're looking for and why.
So for hip palpation, the first thing we want to look at is the Asis. So if we come from the iliac crest, so the bony prominence at the front of the hip, you'll feel this hook, and that is the anterior superior iliac spine. If you roll down from the Asis, this is where the sartorius origin is, and medially from this tendon is the rec fem. Laterally 2 centimeters from the Asis and down 2 centimeters is going to be the tensor fasciae lata tendon. And you can palpate the ITB laterally and then move down the leg towards its distal attachment. The inguinal ligament can be found from the Asis. And we can also palpate the adductors for pain, or palpate through the adductors for pain and symptoms. Posteriorly, we can look at the PSIS, so from the ilium down to the dimples, this is where the PSIS is. And the ischial tuberosity can be palpated. This is under the gluteal fold at the origin of where the hamstrings are. We can palpate the sacrum, and we can do this by travelling down from the lumbar spine. The sacrotuberous ligament is in a line between the sacrum and the ischial tuberosity. The greater trochanter can be felt laterally. It's the most lateral aspect of the hip, and it's the bony prominence that you can feel most prominently in that lateral area of the hip. The piriformis muscle can be palpated between the sacrum and the greater trochanter. You can also palpate the sciatic nerve by going between the ischial tuberosity and the greater trochanter. When we look laterally at the greater trochanter, we can look at palpating posterolaterally from where this is, and this is where the tendons will attach and where the greater trochanteric bursa will be. This is particularly useful in GTPS patients, or greater trochanteric pain syndrome patients, in which you'd expect this point to be locally tender.
If you're a physio or therapist looking to get better, then press the subscribe button, click the bell icon, and that way you'll see all our current videos that are coming out, and they're all designed around helping you to get better. If you enjoyed this video, then click this one here because you are going to love it.